My name is Dr. Jill Moore. I practice family medicine in Columbus, Georgia. I'm from Columbus, Georgia originally. I had always been interested in science and math as a student. My grandmother was a science teacher for 4th grade, so she always was purposeful to try to keep us grandkids interested in science, and would do little experiments at the house. And I've always had an interest in being able to help others and in ways that I knew I would be able to do that. As a smaller child, I always assumed that a woman could be a teacher or a nurse, but then once I learned that a woman could actually be a physician, then that's what I wanted to do. I've been practicing medicine since 2000 when I finished residency, and I initially worked in South Carolina for 5 years after finishing residency there. But then in 2005 I moved back to Columbus and to be with my family. That's been a good move for me. I've enjoyed being with them here. At the time of the move, my mom and dad were here, my brother and his wife, his 3 children are here. All the aunts, uncles, cousins are here, except for only one that moved away. So it was always the holidays, you know, for all of us being together, and I wasn't always there when I lived in South Carolina. So that was important to be able to be home with all the family for those occasions. So I chose the specialty of family medicine so that I would be able to have a good work-life balance. I really enjoyed the surgery rotations. They were amongst my favorite. However, the call schedule was quite demanding for those, not only during training, but in the practice afterwards. And I wanted to have more time with family, then family practice allows me to do that. When I began practice in 2000, there were very lenient insurance companies that would allow us to prescribe as we saw fit for our patients' needs, and very few procedures required any prior authorization issues. Very rarely did we have to make a phone call to the insurance to get needed tests or concerns. We had minimal administrative paperwork related to caring for patients in that way, that we could actually spend more time with patients then. Today, the practice of medicine has changed to very heavy administrative burden. The paperwork is very heavy for us, that we spend a lot of time, for us personally and our nursing staff, on the phone or by email, faxing, trying to get approval for medications that our patients really need, but we are trying to do our best to get that. If they need a procedure or a test done or a referral to a specialist, it's a lot more effort to be able to get those accomplished in a timely manner. But at the same time, we still have patients to see, so our time is consumed by these extra activities that we didn't have to do before. A typical day here, I could usually start around 8:15 or so. We'll see usually 12 to 15 patients per half day. Often I will have a patient who needs more time than their allotted scheduled time that they were given. So I feel obligated to spend more time with that person to take care of what they need. They need refills taken care of, they need help with a referral. So I'll spend that time, but then I may have gone past their scheduled time, which puts the next person in delay. I feel hurried and rushed to get to the next patient. I do feel bad when I have patients to wait, because I know they've made arrangements to be off of work, and they've made arrangements to get a ride with someone to be there. And so I feel like I'm constantly apologizing to the patient for, thank you for waiting, but other people had problems ahead of you. So I feel sometimes hurried to get to the next person, but then not wanting to leave things undone. You know, you can't help but get behind sometimes. Different times of the day we'll receive messages from patients that they either want to be seen or that they're requesting medication to be called in. I try to take care of those messages as often as I can between seeing other patients. Occasionally there are openings in my schedule where I can work some patients in, but it's not uncommon that my schedule may be full where I can't see them as fast as they would want to be seen. So I'm torn between how many patients can I see versus I need to spend time with those patients, but yet more people may want to be seen, so that would shorten the time of the other visits to allow for more, accommodating more patients to come. The paperwork of the amount of paperwork that is required continues to build, and I try to get some of those done during our lunch hour or after work, but time constraints that I have, and my nurses, of course, need to go home and tend to their families and children, that I can't keep them, very late, and I have a family of my own at home that I need to be able to go to take care of. I usually don't finish all my patient notes at the time of the visit, that I will either get to those in the evening, or they may even be delayed till the weekend till I can complete those records. It's not uncommon that there's several hours on a weekend that are spent with doing those charts, which interferes with my family time. If my children wanted to go to the movies or to go to the park and play, it's not uncommon that I would tell them we couldn't go, or they can't have a play date because I'm having to take care of medical records and trying to keep up with paperwork that patients have a need for their insurance company. Concierge medicine, to me, should allow patients to have quick access to get visits. I would hope usually same-day visits available, or next day if appropriate for those. I would have more time dedicated to spend with patients to take care of the details of things. If we need to look up information with them, we can gladly do that and provide them with additional information, or take time to explain to their family member who's with them what special care may be needed for their loved one. I want people to know about their health conditions. I think the more I'm able to teach them about their health conditions, they can self-manage better. Patients usually want to do the right thing, but if they don't understand necessarily why they're given instructions, they're less likely to follow through with those. They may not appreciate the importance of some of the instructions that are given. So we want to try to keep patients out of trouble, or avoid the need to see a specialist by taking care of their chronic health issues. With my practice, there would be less paperwork just because there are fewer patients. The patients should be completely satisfied at the end of each visit that all of the details that they need have been taken care of, the correct medicines have been refilled to the correct pharmacy, that their referral information has been sent to that provider correctly. I want them to know that it is my intention to do all of those things at every visit. We want to make sure that we are complete and thorough and answer all the questions that we can at that visit. There are plenty of circumstances when routine screening exams or immunizations, some patients just want additional information about those before they're agreeable to pursuing those. The current recommendation is by age 50, everybody should look at having a screening colonoscopy. So for some patients who have managed to get past 52 years old, they may require an additional information to find out more about that, to convince them that it is a beneficial procedure for them to have. I did have a 52-year-old woman with teenagers in high school that finally came to agree to her test, with learning that by doing the test, it can help to prevent cancer. Almost all colon cancer starts as a polyp, so if they remove those polyps during the colonoscopy procedure, it may help to prevent cancer. Unfortunately, her exam revealed she already had cancer at age 52, so fortunately she was diagnosed in a stage where it was treatable, and her children have now all graduated high school and she is alive and healthy. With this change into concierge practice, I will have more time to spend with patients to discuss their long-term health goals for those who want to be healthier and have a deeper understanding of their chronic conditions. I want to make sure that patients understand the importance of exercise and how they can do that even if they have chronic health conditions. Most people want to be well, and I want to try to help improve their longevity with more healthy years. Another benefit of the concierge practice that I'll be able to review the specialist notes with the patient to make sure that we're on the same track with medication changes that were made. The amount of referral or consultation notes that I receive from them, it can be up to 200 pages a day. To make sure that nothing is missed, we'll have more time to review those notes together and make sure that they've made changes that the specialist has suggested, and that they're complying with the new instructions they may have been given. That may be different from what I had given them, but we need to agree on what they need to do, usually to follow the specialist recommendations, but occasionally I'll have a reason not to do that, unknown to the specialist. So we want to make sure that we're all practicing for the benefit of the patient. For patients who are leaving the hospital to come back to the practice, we'll have more time to be able to review the circumstances of their presentation to the hospital, the care that they received and specialists they may have seen while they were there. review any medication changes that were made at discharge, or if they have special instructions, they need additional lab testing after getting out. If they had an abnormal blood level or an abnormal electrolyte level, we need to recheck those when they get out of the hospital. Make sure that their blood pressure is still appropriate and that they were able to fill their medications that were prescribed from the hospital, and if not, why not? A frequent reason for patients to be readmitted to the hospital is they didn't get their prescriptions filled on discharge. So we want to make sure that we're keeping things neat and tidy after discharge so that doesn't happen accidentally. Patients will have more direct access to be able to talk directly to my nurse. That gets messages to me faster so that they don't get lost within an operator system to return notes to my nurse, who then reveals notes to me. That should be a more streamlined process to be able to get them answered more completely and timely. I want my patients to join my practice to know that it is my intention to provide better care than they are currently getting. I want them to know that I will have extra time to spend with them in their visits. I will have extra time to pay detailed attention to their consultation notes. I will be the one to refill their medicines at the time of the visit. It will be me doing those things for you. Everybody's heard the saying that if you want something right, do it yourself, and I want to do as much for you as I can.